patients that have sickle cell anemia have to go through daily. Can you guys imagine sitting in agonizing pain for hours or days or even weeks, and there's nothing you can do about it? What I'm talking about today is sickle cell anemia. Sickle cell is a disease that sickle cell is a disease that changes the shape of your blood cells. So they're sickle shaped, and it makes it hard for the blood to flow through your body. Sickle cell affects all races, but it's mostly people that are Indian and African American get it. Although most of you in here are not African American, you can benefit from knowing about this disease because you may know somebody who has it or is affected by it. I feel obligated personally to talk about this disease today because I am affected by it personally. It runs in my family. So me and my mom, we have the trait, and I have 2 siblings that have the full disease. Sickle cell anemia is a disease that causes a lot of pain and suffering that largely affects the body's vital organs. Today, I will inform you guys about the main points of the disease, and then I will talk to you about how it is treated. So first, let's talk about the main details of the disease. What is sickle cell? So like I said before, it changes the shape of your red blood cells to make them sickle shaped. This is a picture of normal red blood cells, and this is a sickle blood cell. So with the sickle blood cells, like I said before, it makes it hard for the blood to flow through your body correctly. And red blood cells in particular, they carry an important substance called hemoglobin. Hemoglobin is what carries oxygen through your blood to the parts of your body. So when you have sickle cells, it lacks the hemoglobin that it needs. So your organs and your body parts don't get the correct oxygen, which causes pain and just a lot of problems. So as you can see here, this is how normal red blood cells flow through your veins and stuff, and then this is how the sickle blood cells can get clogged, blocking the blood flow. According to the official sickle cell anemia website, sicklecelldisease.org, normal blood cells can last up to 120 days, but sickle blood cells, they only last around 16 days on average, so it can be less or more before they become sickled, and no blood replaces it. You have to get a blood transfusion in order for it to go away. So now I'm going to talk to you about the different types of sickle cell. There is sickle cell, there's SC and SA and SS. SS and SC are the most common ones, but SS is when, according to the article's types of sickle cell disease on scantic.org, if someone has SS, they inherited the gene from both sides of their family. And if someone has SC, then the hemoglobin that their blood produces is both S and C, and they don't get sick as much as people who have SS. And there's also SA, which is the sickle cell trait, which is what I have. And when you have the sickle cell trait, it doesn't affect you like physically, like I don't get symptoms and I don't feel like pain or anything, but my body does produce hemoglobin A, which is the normal one, and hemoglobin S, which is the sickle one. So now, how do you get it? Sickle cell is not contagious, and you can't like catch it from like doing drugs or anything. The only way to get it is through inheritance. You get it from your family. So this is kind of difficult to explain, but okay. So let's say you have one parent that has the disease and one parent that doesn't. So the chances are that the child they produce, the chances are 50-50 that they'll have the sickle cell trait, but they won't have the full disease. If you have 2 parents that have the trait, the chances are 50-50 that the child can get the trait or the disease, and if both parents have the full disease, then the chances are 1 in 4 that your child will have either the full trait or sickle cell, the full disease or the trait. Okay, some symptoms of sickle cell include pain, crises, and low red blood count, damage to organs. Pain crisis is when the organs don't get the oxygen it needs, and the blood is clot in the veins, so it causes pain in the patient. And low red blood count, that causes anemia. And the damaged organs, like for example a damaged spleen or a kidney, can cause a lot of infections, so that's another symptom, having a lot of infections. So now that I told you about how it is, now I told you about the details, I'm going to tell you about how it's treated. So this is blood. One way to treat it is getting a blood transfusion. For my sister personally, she has had a lot of blood transfusions. Like, she's been in the hospital for, I think, a whole year at a time. So during that time, she had a lot of blood transfusions. They sometimes they are effective, sometimes they're not. It just depends on the actual person. Another way is antibiotics, because you get a lot of infections because of the disease, so it causes a lot of infections. And pain medicine. Pain medicine is probably the most because pain crises are something they have to go through like daily sometimes, so the pain medicine is also what they get. But according to learngenetics.edu, folic acid is another effective way of treating sickle cell because it helps rebuild the red blood cells. So today I've talked to you about the main details about sickle cell, and I've talked to you about how it's treated. So in conclusion, sickle cell is a life-changing disease that affects a lot of people and it causes a lot of medical problems, so more people should be informed about it. Today we learned about what sickle cell is and how it's treated, and how it's not inherited. And how it's not contagious, it's inherited. So, in conclusion, I wanted to share this with you guys today because it is such an important thing, and I believe that if I help spread awareness, maybe one day there will be a cure. Thank you.